Hey everyone, so my name is Monica. For those of you who don't know me, I am a nursing student and I am actually graduating in December of this year, so that's very exciting. And today's video I want to talk a little bit about my nurse internship this summer and why I think it would be so beneficial if any of you were able to get one, or why you should at least apply. So to start off, my internship was at a hospital. I was on a medical surgical unit that had telemetry on the unit. For those of you who don't know, that's where they monitor, like they have all these stickers and it monitors their heart rhythms and everything. So it says if they're going to an arrhythmias or if their heart beats too fast and all of that. So that was my unit this summer. It was a 10-week internship. So, a little over 2 months, and it was honestly the most incredible experience I've ever had, like, in my time of nursing school. So, for those of you who don't know, internships, especially summer internships, are not affiliated with universities. So, you do have to apply outside of your school. It's not, like, school affiliated. Nothing's with your school, your university, nursing program. So, it's completely separate. I had to apply by myself, my school, I mean, like, you can get help from your school, like, with your resume, but, it's not like they can, get you in, like, you have to do it by yourself. So, how you basically apply is most applications will start in October, through December, and then you find out, you have, like, interviews, and, like, I had mine in, January, and then, like, I found out in February, and started in the end of May. So, my experience, I have been on a medical surgical floor before. I spent 7 weeks in one this spring. And so coming onto it, I kind of knew the basis of, like, what a medical surgical floor, like, patient population was. So it's a lot of older people, a lot of, congestive heart failure, chronic obstructive pulmonary disease, COPD, lots of kidney failure. So I knew, like, that kind of stuff, and I liked that. I liked that variety, so I was really excited to start because I figured out through nursing school that I loved a variety of patients. I liked not everyone to have the exact same kind of thing going on. I liked having this person have this and this person have this and all this stuff, and I really enjoyed kind of challenging myself that way. So I thought medical surgical would be the perfect place for me. So I started out, and my preceptor was actually a professor, so that was really cool because he, like, gave me such challenging questions. Some of them I didn't know the answer to, but, it was really good to kind of challenge myself, like, oh, what medication would I use for this? And, like, oh, how would I get rid of potassium if my patient was too high? So, and also, too, I was really excited to see kind of the flow of being a nurse, because it's totally different, and a lot of people will tell you this if they've had an internship. It's completely different having a clinical versus having an internship, because for a clinical, you're there, like, once a week, it's, I don't know, so, but I mean, with an internship, you're there, I was there 4 days a week, and, I was able to, like, go on and do the assessments by myself, and, like, kind of talk to the patients and do all this, and, like, my preceptor would be, like, in the room just listening, making sure I was, saying everything right, but it was, like, I really felt, more comfortable doing things and, like, kind of taking on that role of a nurse. Like, I felt my confidence in myself grow, because there's so much more to nursing than, like, just the clinical can teach you, unfortunately. And if you don't get an internship, you'll learn, like, starting off, but, like, there's labs you have to do, like, you have to look over, especially as a night shift nurse, at least there, like, the nurses do labs in the morning, like, lab draws. And then you have to, like, make sure to monitor the patient's labs. Like, is their magnesium low? Is their potassium low? That's something you have to replace. So that's stuff you have to look over and everything. And there's so much to nursing and so much role. It was really beneficial to kind of see the day of a nurse and then keep going and slowly, like, learning, like, what to do. Because sometimes, like, oh, like, what do I do now? So there's always something to do. And I just loved learning how the flow of nursing went. So I had, 3 or 4 patients. So, learning kind of, like, medication-wise, who do you do first? And that's all based on priority. So, for example, if someone is having, like, a medication they need, like, on the dot, you know, like if it's like like an antibiotic, obviously you do that first because they need to get the antibiotic in them so they can stay healthy, you know. But other stuff, you know, like if they're just having, I don't know, like a multivitamin, like another patient, like you probably wouldn't start with them first because everyone has the same time for meds, but you have to know which one's first. And, you know, too, like if you're getting a blood pressure medication such as metoprolol, that one lowers your blood pressure and your heart rate. So you have to, you know, you have to check the blood pressure and heart rate before giving it, because if it's like under 100 systolically or under 60 heart rate, then you can't give it. So it's all this stuff you just kind of get into the flow of doing, you know, like insulin, all that different stuff. I just really enjoyed. Like, I feel so much more confident going back to school in the fall knowing what I know. You know, like I was able to see, like some people have ports. That's a way like they can get their medication. So it's more invasive. So I got to like see that getting removed, and like a nurse did that. So it's like so much procedures I like learned about and saw were so cool. Like I saw a nasogastric tube be inserted, and that was so like cool because I've seen it on a mannequin before, but I've never seen it in person, and that was cool. I inserted actually 8 IVs, which is pretty cool because, you know, my school doesn't teach you how to do that. So I learned, I was able to do it, and now I feel pretty good about doing it. You know, I did it like mostly in the arm, anterior wise. I think that'd be it. Yeah, oh my god. And I did it mostly here. I learned about, you know, like if you, like how to feel for like a valve, because it feels like a little harder, I guess, because you don't want to like insert an IV like right in the valve. And then like, I also did like an AC and when I was in the ER. So like I learned so much about IV placements, getting comfortable with that, because I think personally the hardest part about IV insertion is like the mechanics of it. So after you actually get, you know, the needle in, you're pulling out, and now you have to unscrew it with one hand and attach the saline with the other hand, and you like make sure it doesn't bleed everywhere. And so like all the mechanics of that, like I feel so much better about, and I just learned a lot. Hey, Ruby. So, and you know, like it's just getting like, even to giving SBAR, giving a report at the end of the day. She's sitting on my lap right now. Hi. Even giving a report, you get so much more comfortable about, because you learn about, and also too, every nurse has their own different way of like what information they like giving during report. I think it's just important to find out what you like and what you find important, because like some people like to know like lab values. Like I only give the abnormal values, you know, so I don't know, it's just finding like also too like what you like, you know, all these different nurses have all these different ways of doing stuff, you know, so it's like finding out what you like and taking bits and pieces from them of incorporating it into your own practice. So I really like that as well. I mean, I learned so much more about heart failure and telemetry, like reading those strips and analyzing those, and kind of just, you know, I got to like deal with the chest pain like assessment too. So that was, and like I was with the patient too when they were actively having a heart attack. Like that was crazy. So there's a lot of, you know, especially with medical surgical, like, you know, patients could go from like, you know, stable to like all of a sudden one of those things. You never know. So it's always good to like keep an eye on it and make sure, and it's also like, you know, keep an eye on it and then like make sure they let you know if something is wrong, because some patients like don't want to bother you, unfortunately, when it comes to like stuff like that. It's like, no, like that is stuff you need to tell me about, like, you know. So, and it's also good, I think, as a nurse internship, you really learn how to delegate tasks to like your nursing assistant. So, you know, for example, I'm charting, I'm doing notes and stuff, and my patient like wants some gel. So, you know, I, you know, call up the nursing assistant and I'm like, hey, do you have time to get them one? You know, and if they can, that's awesome. Also too, you know, if they can do vitals, that's really good. It's also good, you know, to tell your nursing assistants too, if like any vitals are abnormal, to call me right away. So that was really good. That made me feel like more like a nurse, you know, like, yeah. Yeah, like for, yeah. I'm trying to think of like other stuff, but it was just so much. Like I learned so much more about medication, about like what medication could correct this, like what should I do, when to call the doctor, like talking to pharmacists, like all this great stuff that's gonna help me like going like to my first nursing job so much more confident. I mean, there's still stuff like I want to work on, like I want to like be able to insert like a nasogastric tube or all this stuff, and like learning how to discharge a patient, learn how to admit a patient, like all this great stuff like I feel so much better about. So all of these skills are so important to nursing in general, and I feel like I didn't get like, nursing school does its best, but I mean it can't teach you what real life nursing can, because you're still in school, but being an internship, I felt like I was exposed to all this and I had great knowledge, and I was able to like do admissions really efficiently and get this all done and like help with discharges and all of that. And I think that like the experiences you gain from an internship are so great that it will, like, even if it's in the department you don't like for example, if you're like, I really want to be an ICU nurse, but I got an internship at an orthopedic floor. Okay, so you didn't get your dream, internship, but just learning how about the flow of nursing is so beneficial, like you'll really do great in your assessments and distinguishing all this and pain control and, delegating tasks. Like there's still so much to learn from an internship, even if it's not the floor you like, that I think that you should definitely go for it if you can, because, I mean, it's changed like everything of like my skills. It's just made everything so much better. And of course I still have so much to learn, but it just made me feel so much more confident. I had 10 weeks, over 300 hours on this floor, and it was completely amazing. And plus too, if you do well and you're great with everyone, all that stuff, that would be an awesome place. And I'm sure the nurse manager would be like, hey, you want a job? Or if you worked an internship there, I'm sure they'd be much more likely to hire you, even if it's on a different floor, because you've been there. So I definitely think you all should, if you can, at least apply for an internship, because it was like it's incredible the things that you learn there, because you're there so often, and I just feel so much better going back to school. I feel so much more confident that I've learned a lot, and that I can really, I feel better about starting off as a nurse, because like I was night shift a couple of times, and it's most likely where you'll start, especially as a new grad. So I learned like kind of like what night shift is like, so like I had 5 to 6 patients, which is a lot. It doesn't sound like a lot because everyone's like, oh, they're sleeping, but it's pretty hard to sleep in the hospital because you have to like wake people up, do their assessments, give them their medications, start antibiotic, do all this, turn people. So it gets to be very busy. So I definitely feel for all you night shift nurses, like that's a lot of work, but it just, yeah, I highly encourage it, especially if you can. I think medical surgical is a great place to start because there is so much of a variety of patients. It really helps you like learn more about a lot of different types of things going on. So if you were just at like an orthopedic floor or just cardiac, it would just be that thing. But I had a bunch of like chest tubes and nasogastric tubes, G tubes, just a lot of different things going on, a lot of alcohol withdrawal as well. And also there's a lot of more younger patients than I expected. I had a decent amount of patients in their 30s who were there, or like people with diabetic ketoacidosis. We help with the drips on that. So there's so much variety. I think especially medical surgical would be a great place for anyone to just explore. If you don't want to work there, like I totally get it, but even just to like have an internship there, I think you will learn so much and your skills will be awesome. So that's kind of my experience in medical surgical nursing. It was incredible, and why I think it's so beneficial to have an internship, and I'll support medical surgical if you go for that, but even anything would really help. So yeah, if you guys have any questions, feel free to let me know. It's just a little synopsis and why you should go for it. So I hope you all have an amazing day, and school starts soon, or if it hasn't, so have an amazing rest of your summer. Don't forget to treat yourself. All right, you guys have a great day, and Ruby says hi too. Bye.